In this presentation, we will be discussing Down syndrome, including pathophysiology, manifestations, diagnostics, treatment, and education. Pathophysiology. Down syndrome, also known as trisomy 21, is a genetic disorder causing varying degrees of intellectual impairment, as well as distinct congenital abnormalities. There are 3 different types. Non-disjunction is the most common with 95% of cases. Translocation and mosaicism make up the last 5% of cases. It is the most common cause of intellectual impairment and occurs 1 out of 800 births per year. It affects more boys than girls and non-Hispanic white children. Manifestations. The phenotype for Down syndrome is identified by birth characteristics. The baby can have hypotonia or low muscle tone when born. Their heads can have flattened occiput, depressed nasal bridge, almond-shaped eyes that slant up, prominent epicanthal folds, white specking of the iris, protrusion of the tongue, high arched palate, or low set ears. Their hands can be broad with short fingers, abnormalities of fingers and feet, and transverse palmar creases. Congenital heart disease is also a manifestation and a big concern. Diagnostics. Down syndrome begins in utero and can be discovered with diagnostic testing. Prenatal testing such as amniocentesis or chronic villus sampling can be used to detect Down syndrome. A triple maternal serum screen can be drawn, which will show a low alpha-fetoprotein, a low unconjugated estriol, a high human gonadotropin level. Down syndrome is evident at birth because of different physical characteristics, as discussed in the last slide. Non-pharmacologic treatment. Treatment of Down syndrome is based off each individual needs. Immediate care after birth is important. This will include an interdisciplinary team that is made up of physical therapy, occupational therapy, speech therapist, special education, and primary physician. Other forms of non-pharmacological treatment can be tools to make their lives easier, such as assistive devices that help them get around, hearing aids if impaired, and special computers are a great tool for learning. Pharmacologic treatment. There is still a lot of research being done when it comes to pharmacological treatment. For those with Down syndrome, amino acids can be given to help with brain activity. Others take psychoactive medications such as central nervous system stimulants, SSRIs, atypical antipsychotics, and alpha-adrenic agonists. Education. Educate parents and caregivers to watch for slow feedings, choking, spitting up, and abnormal stools. These signs can be indicative of complications and should be reported to the physician. There are also lifetime complications that can occur, such as GI conditions, endocrine disorders, and cardiac conditions. Our nursing diagnosis is self-care deficit related to intellectual disabilities as manifested by cognitive impairment. Looking at this chart, you can see the difference between a typical child and a child diagnosed with Down syndrome, and when they meet their specific milestones. Interventions. Encourage person to perform normal activities of daily living to the level of their ability. This will help them stay involved in their own cares. Use adaptive dressing and grooming equipment as needed. This includes long handle brushes, Velcro shoes, or grasp devices. This will help increase self-care ability. Encourage activities that support or enhance their spiritual care. This is important to children in their relationship with family cultures. People with Down syndrome are living longer. Due to advances in medicine, they can still live full, normal lives, such as get a job, play sports, or be involved in relationships. Many live in group homes that also encourage independence. Question number 1. A mother has recently been informed that her child has Down syndrome. You will be assigned to care for the child at shift change. Which of the following is not associated with Down syndrome? A. Palmar crease. B. Brachycephaly. C. Oily skin. D. Hypotonicity. The answer is C. Oily skin. Down syndrome usually presents with atopic dermatitis, red, scaly, itchy skin, most likely to occur on cheeks, behind ears, knees, and in elbow creases. An infant born with Down syndrome should be assessed for which condition? A. Clubfoot, B. Cleft palate, C. Cardiac defect, or D. choanal atresia. The answer is C. Cardiac defect. Approximately 30 to 40% of infants born with Down syndrome have congenital heart defects.